If you have type 2 diabetes, you already know that smart medication, diet, and lifestyle choices can help you maintain healthy blood sugar levels and enjoy an excellent quality of life. But in some cases, despite our best efforts to manage the disease, issues can arise, and that risk may increase with age. Warding off the serious and sometimes fatal health complications linked with type 2 diabetes starts with being aware of their potential. Then it's important to take steps to decrease their risk. What causes health complications of diabetes? Even though your body needs sugar for energy, too much sugar can be a bad thing. Type 2 diabetes occurs when your blood sugar level remains consistently high due to a condition called insulin resistance. During digestion, your body converts carbohydrates into sugar, and then your pancreas releases a hormone called insulin to help this sugar absorb into your cells. But due to insulin resistance, your body doesn't use insulin properly, which forces your pancreas to work harder to produce enough insulin to meet your body's needs. Related: everything you need to know about insulin if you have type 2 diabetes. Hyperglycemia occurs when your pancreas can't keep up and your blood sugar rises to an unhealthy level. Persistent hyperglycemia can lead to diabetes complications because too much sugar in the bloodstream can cause tissue, organ, and nerve damage, and weaken the immune system. Hyperglycemia can develop gradually over days or weeks, and symptoms include frequent urination, increased thirst, fatigue, headache, and blurry vision. Risk factors for type 2 diabetes complications. To avoid complications of type 2 diabetes, it's imperative that you take care of yourself and keep your blood sugar under control. That means taking your diabetes medication correctly, that is, in the proper dosage and at the right time, every time. Related: diabetes medication mistakes to avoid. It's also important to maintain a healthy weight and good cholesterol levels. This becomes even more important as you age, or if you have been living with diabetes for several years, research shows. Any factor that interferes with your body's ability to use insulin properly can increase your chances of developing health complications. This includes a sedentary lifestyle, because activity and regular exercise can help your body overcome insulin resistance and lower your blood sugar levels. Plus, exercising regularly can help you maintain a healthy weight, and losing just 5 to 7% of your body weight has been shown to keep prediabetes or diabetes from further progressing. Meanwhile, other research suggests managing your weight could even help reverse type 2 diabetes. Related: how to stabilize your blood sugar. Stress, illnesses, and certain medicines can also affect how your body uses insulin. So your risk for complications is also higher if you have an illness or infection, take steroids, or deal with chronic emotional stress. How common are diabetes complications? While the exact prevalence of diabetes complications as a whole is unknown, researchers have observed that the longer you live with diabetes, or the older you are overall, the greater your chances of developing further health issues. What are the most common complications of diabetes? Side effects or complications of diabetes can be short-term, acute, or long-term, chronic. Short-term means the problem can develop quickly at any time, and long-term means the problem generally develops later and more slowly over a period of time. Possible short-term complications of diabetes: sexual issues. Because high blood sugar can damage nerves in the genital area, some people with type 2 diabetes have sexual side effects. This complication affects up to 75% of men and 42% of women with diabetes at some point. Nerve damage can cause weak ejaculation, and some women experience painful sexual intercourse and can't achieve orgasms. If unable to manage glucose levels, these side effects can worsen over time. Diabetic coma. Even though diabetic comas are rare, there's the risk of unconsciousness with hyperglycemia and hypoglycemia, abnormally low blood sugar. Hypoglycemia can arise from excessive insulin, typically from drugs such as sulfonylureas or insulin. Unconsciousness happens when your brain doesn't receive a sufficient amount of glucose to function properly. Early warning signs of hypoglycemia include hunger, sweating, and shaking. Related: warning signs of low blood sugar. A diabetic coma can also occur with hyperosmolar hyperglycemic nonketotic syndrome. This condition is more common in the elderly and people with other chronic illness, but it can occur in anyone with poor control of diabetes. When your blood sugar level rises, your body compensates for the higher level by eliminating extra glucose through urination. This process can lead to severe dehydration, causing a variety of complications, including muscle breakdown and even loss of consciousness. This is a potentially fatal complication requiring immediate medical attention. Diabetic ketoacidosis. This condition mainly affects people with type 1 diabetes, but can also occur as a rare complication of type 2 diabetes. Like the process leading to hyperosmolar hyperglycemic non-ketotic coma, this process can lead to severe dehydration. But a deficiency of insulin also leads to ketone production. With insulin deficiency, sugar can't absorb into cells and the body can't use glucose for energy, so it starts burning fat for energy. This process causes the body to produce a toxic acid called ketones. A buildup of ketones in the bloodstream can poison the body and also lead to a diabetic coma. The risk for ketoacidosis increases when you're sick, have an infection, or skip an insulin dose. Your body produces more cortisol and adrenaline when sick, which can counteract the effects of insulin and raise your blood sugar. So check your blood sugar every 2 to 3 hours while sick, and then use ketone urine test strips to check your ketone level if your blood sugar is higher than 300 mg per deciliter, milligram per deciliter. Diarrhea from medication use. Some people with diabetes take the oral medication metformin to treat high blood sugar. This is usually the first line of treatment for type 2 diabetes, but it can also cause side effects such as nausea, constipation, and diarrhea. Side effects vary from mild to severe, and typically go away once your body adjusts to the medication. Possible long-term complications of diabetes: diabetic neuropathy and amputation. High blood sugar can damage nerves in the body, including those in the lower extremities, such as the legs and feet. This complication can cause diabetic nerve pain, bone and joint pain, numbness, poor blood circulation, and ulcers. If left untreated, an ulcer can become infected, and reduced blood flow can result in amputation of a toe, foot, or leg. Diabetic neuropathy, the term used to describe nerve damage in diabetes, affects between 30 and 50% of people with diabetes. Risk factors include uncontrolled blood sugar, smoking, high blood pressure, alcohol abuse, and obesity. Related, the 4 best exercises for managing diabetic neuropathy. Eye problems. Chronic high blood sugar can also damage the blood vessels in the back of the eye. This condition is known as diabetic retinopathy, and it's responsible for more than 10,000 new cases of blindness each year in people with diabetes. The risk of this complication increases with age. 19. Because diabetic retinopathy can affect both eyes, it's important to contact your doctor immediately if you notice any vision changes, to prevent vision loss. People with type 2 diabetes are also at higher risk for glaucoma, which is prolonged pressure in the eye due to high blood pressure. About 40% of people with diabetes will develop glaucoma. Additionally, persistent high blood sugar can cause a cataract or swelling in the lens of the eye. This can affect vision and clarity. Heart disease and stroke. Heart disease and stroke are other complications of diabetes. High blood sugar causes hardening of the blood vessels, which can contribute to high blood pressure. Elevated blood sugar can also thicken blood, causing the heart to work harder to deliver blood throughout your body. High blood pressure increases the risk of heart disease and stroke. In fact, people with diabetes are 2 to 4 times more likely to die from heart disease than people without diabetes, and they're also 2 to 4 times more likely to have a stroke. Both can lead to premature death. Related, diabetes and heart disease, what to know about the connection. Kidney disease. About 40% of people living with diabetes will develop kidney disease. Persistent high blood sugar can damage blood vessels in the kidney. This decreases kidney function and can result in kidney failure if diabetes remains uncontrolled. Being a smoker and having high cholesterol or high blood pressure increases the risk. There's also a greater risk if you have a family history of kidney disease. Sleep apnea. Sleep apnea is when breathing pauses while you're asleep. Symptoms of sleep apnea include daytime fatigue, loud snoring, and waking up coughing or choking. This condition sometimes goes undiagnosed, but it's estimated that up to 80% of people with type 2 diabetes also have obstructive sleep apnea. The more severe the case of sleep apnea, the harder it is to control glucose level. If left untreated, sleep apnea can cause high blood pressure, heart disease, and sudden death. Diabetic dermopathy. When the blood vessels that supply the skin with blood become damaged as a result of uncontrolled blood sugar, oval red or brown lesions can develop on the skin. Diabetic dermopathy occurs in up to 55% of people with diabetes, and being older than 50 increases the risk of developing lesions. This condition is harmless, and the skin patches don't usually hurt or itch. Treatment isn't necessary, and spots may disappear on their own. Gum disease. High blood sugar also affects your oral health because too much sugar in your saliva encourages the growth of bacteria, which thrives on sugar. The more bacteria in your mouth, the greater the risk of developing gum disease or periodontal disease. This is when bacteria in the mouth causes gum inflammation, red, painful, bleeding gums. Better blood sugar management can help reverse mild gum disease. But if the disease progresses, your gum line may start to recede and the bones supporting your teeth can weaken, resulting in tooth loss. Poor blood sugar control is a risk factor for gum disease, along with poor dental hygiene and tobacco use. People who have diabetes are more likely to develop gum disease than people without diabetes. Related: why dental problems make it hard to control type 2 diabetes. Cancer. Type 2 diabetes also may increase your risk for cancer, including breast, pancreatic, endometrial, liver, and kidney cancer. The exact link is unknown, but it's believed that high levels of insulin in the body encourages the growth of tumors. And because diabetes can lower the immune system, it also becomes harder to fight cancer. The risk for cancer is higher if you're obese, don't exercise, and smoke. How to prevent complications of diabetes. Diabetes is unpredictable, but you can take steps to prevent complications. More than anything else, make sure the diabetes is well controlled. This includes taking your diabetes medication as prescribed and never skipping a dose. It also means making sure your A1C is in your target range. While your goal will vary depending on your doctor's recommendation, research clearly shows that having an A1C of less than 7% can help prevent microvascular complications of diabetes, such as vision issues, kidney disease, and nerve damage. Also, learn how to recognize signs that your diabetes therapy isn't working, and then speak with your doctor before complications arise. These signs include increased hunger, increased urination, fatigue, blurry vision, and headaches. Other tips to prevent complications include losing weight, eating a balanced, healthy diet with plenty of fruits, vegetables, and lean meats, monitoring intake of carbohydrates and sugary foods, managing your cholesterol and blood pressure, exercising at least 30 minutes most days of the week, checking your blood sugar level frequently when sick, testing your ketone level whenever your blood sugar is higher than 300 mg per deciliter, checking your blood sugar before and after strenuous exercise, not smoking, getting annual physicals, vaccines, and eye examinations, practicing good dental hygiene, drinking alcohol in moderation, managing stress. Stress hormones can increase insulin resistance. Related: how to manage work stress if you have type 2 diabetes. How doctors diagnose diabetes complications. If you have type 2 diabetes symptoms, your doctor may perform different tests to diagnose a complication. These include blood sugar testing. This test evaluates the amount of sugar in your bloodstream and can help your doctor determine whether your current diabetes treatment is working. Retina exam. Eye drops are used to dilate or widen your pupils, and then your doctor uses a machine to take a picture of your retina. This test assesses the health of your eyes and can help diagnose diabetic retinopathy. Foot examination. Your doctor examines your feet for signs of infection, nerve damage, and poor circulation. Cholesterol and blood screening. Your doctor will draw a blood sample to check your cholesterol, and your doctor ensures your blood pressure is within a healthy range. High blood pressure and cholesterol increase the risk of heart disease, kidney disease, stroke, and vision problems. Kidney screening. You'll provide a urine sample to see if there's protein in your urine. Protein can be a sign of kidney damage. Treatment for diabetes complications. Treatment for diabetes complications involves controlling your blood sugar. When your blood sugar is very high, taking an insulin dose through injection or intravenously can help stabilize your blood sugar and help you begin to feel better. For more serious complications, treatment varies and depends on the specific problem. For example, treatment for diabetic retinopathy usually involves laser surgery to remove blood and fluid in the eyes and reduce the size of blood vessels in the eye. If you have early-stage kidney disease, lowering your blood pressure and cholesterol, and taking medication can reduce protein in your urine and improve your condition. On the other hand, late-stage kidney disease may require dialysis or a kidney transplant. Doctors will come up with a treatment plan after determining the severity of the condition. Related: 5 smart ways to beat type 2 diabetes. The takeaway: how education can help prevent type 2 diabetes complications. Type 2 diabetes isn't a disease to be taken lightly. So it's important to take your medication as prescribed and be open and honest with your doctor. Don't ignore unusual symptoms of diabetes. These could indicate that your current therapy is no longer working, which puts you at risk for potentially serious complications. If you want to learn more and get an all-natural diabetes prevention program that's right for you, your busy schedule and life, check out our website or click the link in the description to begin. Don't forget to like our video, subscribe to our channel and share your opinion in the comment section. Thanks very much.